My name is Debbie Warren, and it's my great pleasure to serve as the founder and president and CEO of RAIN. I didn't know that much about AIDS when we were first hearing about it in the late 80s, and I was fearful like everybody else. I began to learn a lot more about it, and a key turning point for me was when I found out that a young person from one of the churches where I had served was in a hospital in South Carolina, and visiting with him, he was very young, 27, died a couple of weeks later. It really impacted me. And while I didn't do anything, take any steps at that point, the experience just seemed to stay with me for a while. Also, as a chaplain intern at Carolinas Medical Center, I would meet people who were positive, who were very frail, going home and didn't have anyone to help them. And so out of all those experiences and wanting to involve the faith community in what was happening with AIDS, I heard about a model of using care teams from congregations who would help support people who were at home and very sick and frail and dying. And that's how we got started. I just kept thinking there was a way for congregations to provide real love and care and make a tremendous difference, not only in the people who were living with AIDS and dying with AIDS, but also in our community as far as promoting understanding, promoting compassion, reducing the myths and fears, and helping us get to a better understanding in our community. Many of our care team volunteers had profound experiences of living out their faith in a very, very meaningful way, in ways they would never have anticipated, because many of us sit on the pews and various spaces in our congregations, and we hear the sacred texts that call us to be responsive and caring and to live out these texts in our community. And it's not always easy to find a model to do that. And RAIN care teams provided a remarkable model. I feel like it was a real holy thing. I had been on a mailing list for an organization in South Carolina, faith-based organization, and I got a flyer that talked about an introduction to the founder of RAIN, and the care team model was going to be in Columbia. It was a really holy experience of really searching for a model and then hearing about a model and trying to figure out how I could get the resources to go to Louisiana and study and meet the founder and those kind of things. And then one day this flyer shows up and she's going to be right down the road in Columbia, South Carolina. In fact, I think I got the brochure like 3 or 4 days before she was to be in Columbia that Saturday. And so I made a beeline to the workshop, all-day workshop down there. And I'm a Baptist, so there's a terminology that we use in my faith tradition sometimes that talks about an altar call, and it was really an altar call experience for me going to that workshop. Very powerful experience of, okay, I have more information, I have more tools. Now I really feel called to go with this in the Charlotte area. The Robert Wood Johnson Foundation had given Associated Catholic Charities of New Orleans a startup grant to work in Louisiana and some other states, Arkansas, Oklahoma, Texas, to start care teams in all those states. And so the closest one to us here in Charlotte was Little Rock, Arkansas. So I drove out to Little Rock, Arkansas, and spent about 3 days there with their executive director, Trudy James. And I went to a care team training. I went to a program in a congregation where they were introducing the concept of care teams. I went to a board meeting, and then before I left, they loaded me up with all kinds of materials that they were using, and including their umbrella logo, and gave me their blessing to come back to Charlotte and use any of it I wanted to. Well, I really felt in the early days, and I think probably I still do, in the early days of a lot of fear and misinformation, I felt like I brought a real non-threatening presence to talk about something that people felt very threatened about. I'm very short. I'm very soft-spoken. I feel that I carry a pastoral presence in my interactions with people, and I think all of those things helped me to ease people and help them move from a place of fear to a place of openness, to a place of sometimes responding and getting involved. I think also I think I have a sort of glue-like stick-to-itness. I mean, here we are 21 years later for me since I started working on this idea. And I think there's a glue of holding it together that I bring. I love people, and I love being with people and hearing their stories and offering care. And I feel that's the biggest piece that I bring. We really made a real turn when the new medications were developed and made available. We were no longer helping people die with compassion and care and dignity. We were helping people live. So we had to retrain our care teams to support people who were living, and to understand what that meant, and to understand the significance of it, because I think it's much easier to see how important your work is when things are so dramatic and people are so sick and need so much and the families need so much. It's not as easy when people are living and still have challenges and still need love and care and encouragement, but we don't always see the value of that, particularly in the changes in our culture just since we started RAINN, and how much busier we all are and how much more is expected of us. And we really forget or move away from how important our presence is, of just sitting and listening to someone and being there for them. If we're not really, really busy or trying to multitask, we think we don't bring value. But the healing power of sitting and listening and supporting someone else and having them support you, because we've certainly are on the receiving end of our relationships with people who are positive. It has great healing power, and we have to be reminded of that. I think it just points to the remarkable nature of these relationships and the crossing of things that normally separate us between people of different ethnicities or economic situations, these experiences really provided an avenue for us to get to know people who were profoundly different from us. And that's one of the gifts, true gifts of RAIN. I think the faith community has had an impact on the way HIV is viewed here through their involvement with RAIN. I think many people who would have died or live thinking that they are of no value have found tremendous care by the people who live out the mission of RAIN every day. The most important aspect to me about RAIN is that everyday ordinary people do extraordinary things by taking the sacred text that many of us have learned all our lives and stepping out in faith and courage to do something they probably wouldn't have ordinarily done. My hopes for the future of RAIN are not only that we can continue to provide the essential things that people need on a daily basis, and like getting connected to housing or food or physician or understanding treatment or support groups or counseling, but that we can take a greater role in advocacy. The last few years, much of the focus on HIV has turned to other countries, and there are extraordinary challenges. But I feel that the real crisis of HIV in the Southeast has gone unnoticed. And we now in the Southeast have more people living with HIV and more people who've died with HIV, and we have the fewest resources. And there's a real role for advocacy in North Carolina, in Charlotte. There's a real role for people to work to increase understanding, once again, to be educated. Many more people are being affected than people realize. So I think in order to bring health and healing to our community, we have to reduce the stigma. And by reducing the stigma, we free up people who are fearful of getting a test, who are fearful of getting treatment, who are fearful of going to a support group. And why wouldn't we want to do that for someone else, probably someone that we care about, who's in our workplace, who provides a service for us, who's our family member? Why wouldn't we want to make their road easier by reducing the stigma? Well, first of all, I want people to know that we are here for them, for anyone impacted by HIV, or anyone wanting to learn more about it or get involved. I think also I want people to know that so many of us from so many different backgrounds really overcame our differences to be involved in something that at first seemed very challenging for us. That people can work together. People who are quite different can work together. And really, when it all boils down, people who seem quite different from us really are much like us in the things that bring meaning to our lives, and the things we care about, and the things we love. That we are an organization that has learned those lessons, and that they are lifelong lessons about love and healing and community and that in a time of great fear, Rain brought and still brings light and love to our